spinal manipulation. Easiest way to identify if you fit into this classification is if you're between the ages of 18 to 55 plus. You have a recent onset of low back pain, so within the last 16 days, whether that was an event at a sporting event or a car accident or an exercise program, or you just woke up one day and you've got back pain, whereas the day before that you didn't have any, and you have no fear of having your back cracked or popped. The biggest caveat to this is that if you have any pain that goes down your legs, it can't go past the knee. If you have any pain that travels past the knee, then you don't qualify for getting spinal manipulation. You need something different. If it's above the knee, then you qualify. One quick test to see if you have any pain past your knee is if you bend forward. So Colton here is going to bend forward, knees stay straight, reach down as far as you can go. If doing that increases pain or brings pain past the knee, then spinal manipulation is not the best course of treatment for you. If you do have pain past the knee and you go forward with a treatment that includes spinal manipulation, back cracking, you do run a risk of increasing your pain and having a difficult time getting rid of that pain past your knee. So sciatica, radiculopathy, radiating pain, these are all terms to describe some compression of the disc onto the nerve that travels down behind the leg, and that manipulating that spine could cause more damage to that disc and more irritation to the nerve, which can prolong your recovery, even make things worse, leading to injections or surgery. So we call that peripheralization. So if you move or bend in a way that then makes the pain radiate down further, that's called peripheralization, or pushing the pain to the periphery of your limbs, versus centralization. And the way that we test that is if Colton hands on his hips, knees stay straight, and just begins to lean back slowly. Even if it's pain-free, nice and slow, doing that repeatedly, then he gets less pain in his leg, even above his knee. That's called centralization. So how does he respond? Does he get relief with extension or relief with flexion? Because if he does, then we identify which combination of exercises are going to be beneficial for him. If you identify that you would be a good candidate for spinal manipulation, the best thing to do is to head to a chiropractor or physical therapist who is qualified to do spinal manipulation. The number one cause of any kind of injury due to spinal manipulation is done when people try to self-manipulate. So they try and do it all by themselves. Those are the folks that end up with the most problem, the most damage to their tissues when they try and do it themselves. So we're not going to demonstrate or support that. A lot of folks do, and I know it happens all the time. When you read the literature and show all the folks who have adverse events to spinal manipulation, it most commonly is on folks who are trying to do it themselves, particularly with the neck, but also with the back. So easy enough. There's chiropractors and physical therapists all over the place. Go see one who is qualified to do that if you fall into that category and are not afraid of having your back cracked or popped.